considered your chronic neuro. So you're done with the other packet. Put it away, because you always get confused which packet we're on. It goes away. Can't keep it up. I know, baby. I'm so proud of you. I am. You are so cute. She's sticking in there. Yeah. So the one that says fast. Now put that away, baby. You don't want to look at that anymore. Yeah. Yep. Yeah, so why you don't remember. Okay, you guys ready? Is there anybody next to you that needs their packet? Who's this child near you? Oh, that's you, right? I'm good. So we are all here. Okay, let's go. Chop, chop. Now, stroke. Oh, I didn't put it up there, but well, I had it up there. When you look at this front page, I'm going to write some important things about stroke. I mentioned, because I've been always trying to keep you up on all of this shit and tie it into each other, I mentioned Saturday that a stroke is a clot. It is a clot in the coronary artery here, or it is a clot in the cerebral artery, correct? Okay, so either way you go, you guys know that the patient is going to need something called a clot buster. Now the problem, and certainly when we talked about meds Saturday, the problem is TPA, you don't have much time with the brain. You got a little bit more time with the heart. Remember with the heart, it's within 6 hours. So MI, heart attack, 6. With a stroke, is only 3 hours. So there is a nationwide campaign to teach our beautiful patients in their homes and their jobs and their schools that they only have 3 hours. I was listening to 107.9. They had this commercial on there. They were teaching that if your smile is lopsided, or your face, which is the first one, if your arms are, weak on one side or whatever, and then of course, if your speech is slurred or you don't make sense and you sound kind of crazy, then you only have 3 hours from the time that started. Now, my husband's patient called at the VA. He had a little bit of ringing in his ears. He didn't think it was any big deal, but he called Charles anyway. Charles said, come in now. The patient comes in to see my husband. He says, do me a favor right quick. Take your arms and go up like this. He took his arms and it went just like this. He said, that's it, ER, because he's having a stroke. But it started with ringing in his ears. Okay, so you got to know your neuro, because that's neuro. Okay, now, so this patient, you have fast as your mnemonic. What do you do first? Oxygen. So you got a lot of people you're slapping upside the head with oxygen. You slap the stroke patient with oxygen first. You slap the MI patient with oxygen first. You slap the pulmonary edema patient with oxygen first. You slap the pulmonary embolism patient with oxygen first. A couple people, you got oxygen first. Now, the second thing is hurry up and get a CAT scan. So O2/CAT scan. The diagnostic test of choice is a CAT scan. It's going to tell me if there's a brain bleed. The CAT scan will distinguish between a hemorrhagic versus an ischemic stroke. When you get the CAT scan, it cannot tell you TIA, it can tell you CVA. So CVA is a stroke, cerebral vascular accident. TIA is a warning sign that you're going to get a stroke. Do not call it a mini stroke, because that would be a misnomer. Just a warning sign. Okay, now, so let's deal with that whole issue. Patient comes in, they have facial drooping, they have weak arms on one side called hemiparesis. They have the speech is slurred, the sight is blurred. I always say slurred and blurred. Those two go together, slurred and blurred. Now, you slap them upside the head with some oxygen. You go ahead and get them to get a CAT scan real fast. If it's been determined that your patient has a stroke, you're going to get some TPA going. TPA, or fibrinolytic, right? Thrombolytic, fibrinolytic, TPA, is going to be hung, and that's in a bolus first. Let me say that again. That's a bolus first, and then it's going to be an infusion. You cannot do that for a hemorrhagic stroke, could you? Because you're really going to make this person bleed. TPA is contraindicated in patients who have had surgery within the last couple of months, last couple weeks to months, recent surgery. You're going to make them bleed. TPA is contraindicated in a patient that's had a history of a GI bleed. So you had a GI bleed, hell no, because it's just going to bleed again. Okay, so you got to be careful. I mean, you can't just do willy-nilly whatever you want. If a patient had a stroke before, they're not getting this. TPA, no prior strokes. Okay, so far so good. Now, if you want to, you can put on here that another part of the workup, not as important as a CAT scan, is something called a duplex Doppler ultrasound of the carotid artery. A duplex Doppler ultrasound of the carotid artery. If the patient has been caught in time, they're within that 3-hour window, TPA is very much going to work extremely well. We have a student in our class was taking birth control pills, 40 years old, had a stroke. TPA was started within those 3 hours. She went to nursing school since then and everything else. So it works, trust me. If your patient if we didn't catch your patient within the 3 hours, then our only option would be heparin for that patient to prevent another stroke, right? So it would be heparin. Now, hear me on this. Never, ever, 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 ever chase TPA with heparin. I mentioned that to you when I did meds Saturday. Do not follow TPA with heparin. There's been too many brain bleeds. So what do you follow it with? 325 milligrams of aspirin. And you do that after 24 hours. If a patient has a stroke, you're going to want to make sure you know the only thing you can chase TPA with is an aspirin, 325 milligrams. Now, the last thing I want you to know about this was one more thing. Your diabetics are at higher risk for horrible outcomes. Diabetics are at higher risk for stroke and really bad outcomes. You have some medical guidelines in terms of you not being goofy and trying to be a very good nurse. When the patient hits your door, the clock starts ticking. Within 10 minutes, they better have seen a doctor, which means they saw you first. Within 10 minutes, they better have seen a doctor, which means they saw you first. Within 25 minutes, they better have had that damn CAT scan I told you about. Within 1 hour, they better have had TPA started. Okay, guys, next on the lineup for this guy, turn the page. And you're going to see a very busy sheet on not the first page, but the second page, or the third, I should say. So you've got the lady on one side, right? And then you've got this busy page on the next. When you look at the lady, you've got to remember what kind of stroke she had. Now, each person has to tell me which kind of stroke she had real quick. What kind of stroke do you think she had? Left or right? You first. Just left or right, that's all I care about. What kind of stroke did she have?
It's a affecting her if it's.
I don't care about all that, left or right.
Left.
What do you want? What do you want? What do you want? What do you think, Kara? She have a left or right-sided stroke?
Left.
What do you think? How about you think?
Left.
What you got?
Left.
You?
Left.
Okay. She had a left-sided stroke. Watch what I do. She is, if you look at her very well, she has her which side affected?
Right.
So she's doing this. She can't bend the arm, can she? Nope. So if this side's affected, then the stroke was on the left because it's the opposite side affected. Remember that. Whatever side the stroke was on, the opposite is going to be affected. Okay, that would be the only thing I would tell you to put on her shirt, her little shirt she got on. Left side CVA affects right side. Left side CVA affects right side. You gotta know that. Then on that left-hand side of the paper, I want you to highlight seizures. Some people show up having a seizure, like my student's husband. If that's true, please write it down. You need a EEG, electroencephalogram, EEG. So far, so good? Okay. I don't want you to forget that seizures are detected with an EEG. Other things that an EEG are used for is brain death. EEGs, brain death, seizures, and sleep studies for sleep apnea. Again, seizures, brain death, and sleep apnea, sleep study. This is an RN only patient. You can't delegate this to no LPN. RN only patient. The aphasia on the left-hand side, the aphasia, you see it on the left? There's two kinds, everybody. One is called Broca, and that's on the board. Broca'S aphasia. The other one is called receptive aphasia. Now let me say a couple things to you about this because they're popular. Broca'S aphasia is expressive. They can't tell you what they want to talk about. They can't talk. They can't tell you what they want to say. This is frustrating beyond belief to not be able to talk when you're thinking everything you're thinking. Receptive aphasia, they can't understand what you're saying. They don't know what you're talking about. Which one can't read? Receptive can't read. Receptive aphasia cannot read. They can't understand verbal word or written word. Receptive, they can't understand spoken word or written word. The other name is Wernicke'S. The other name for this is Wernicke'S aphasia. Broca, they can read just fine, but they can't tell you what they want to say. They can read. So for this patient as a nurse, you are going to ask closed questions for Broca'S aphasia. Closed questions. I need to not frustrate my patient. I need to ask you something you can say yes or no to, or shake your head or nod initially. Agree? Closed questions, the answer is always yes or no. Okay. I also need to show you pictures, because while you cannot talk to me, you can help me out with pictures and stuff. The patient with Broca'S aphasia, I need to help them shape their words. They're going to be taught how to talk all over again. So I would say, okay, let's say dog. That's how I would have to talk to them. Okay. Now, receptive aphasia, which is Wernicke'S aphasia. They can't read, they can't understand what you're saying, pictures only. Initially, it's pictures. And then you have them write the word of the picture. So if you show them a dog, a picture of a dog, they need to write D-O-G. They need to write it. Because they don't have a problem talking. They just don't understand what you're saying and they can't read. And this is all from the stroke. Now, which stroke affects this the most? The left-sided stroke. So the lady on your picture, she would have language. The way you're going to remember, L for left, L for language. If you look at the box for TIA, everybody see the box? That TIA has the same exact symptoms as a stroke. Some doctors and nurses call this a mini stroke. I never will, and I never do, because it's not actually a stroke. A stroke is an occlusion caused by a clot. This is just decreased circulation to the brain, more like a narrowing of the vessel. For this guy, both a stroke and a TIA, you can quote me, both are due to uncontrolled hypertension, number one. Stroke and TIA, both are due to uncontrolled hypertension. That's number one. And secondarily, it's due to atherosclerosis. But the first one is that uncontrolled hypertension. Now, in the box, you see the TIA, same damn shit, different day. But the word I want you to focus on, because TIA means transient ischemic attack, the word I want you to focus on is transient. That word, another word for it is temporary. So transient ischemic attack. Technically, it only lasts a few minutes, but it can last, look what I wrote in your box, what I write. Up to 24 hours, it can go until then. As long as it's less than 24 hours, it's a TIA. If the effects are more than 24 hours, it's a stroke. No one I know has ever lasted 24 hours, 23 hours, 22 hours. That shit happens within the hour, and you get them to the ER, and then they say, it's gone. The symptoms disappeared. That's dangerous. Because if the ER nurse is stupid, she's going to let her out. They should be doing a CAT scan. Okay, because what happened? What do we say? TIA in 30 days will be a CVA. Same shit as an MI. Unstable angina leads to a heart attack, remember? And this is TIA leads to a stroke. Now, what kind of stroke could you get if it was AFib? Make sure you know it. Turn the page. Embolic stroke. Don't forget. Highlight on this page birth control pills. In the upper upper left-hand corner, it says OBC, oral birth control pills. The little circle, that's how pills used to look back in the day. So you have the pills as a risk factor, and I see that with women all the time. Then you see dysrhythmias. Put AFib and aflutter and put embolic. Y'all see where it says dysrhythmias? In the same box? No, yes, maybe, could be. Oh, I may have a different box. It's in the middle. What does it say on yours?
Hypertension, smoking, heart disease, cholesterol.
Does it say AFib or aflutter anywhere?
No.
Okay, I want you to, it doesn't say dysrhythmias, nowhere, huh?
No.
Wow, let me look at yours, baby girl. Sleep apnea, prior diet, poor diet, lack of, okay, underneath there, just put dysrhythmias. I'm surprised it's missing. Oh, it's over here, modifiable heart disease. I don't care, put dysrhythmias because it's on the test. Dysrhythmias, and then write AFib / aflutter. AFib / aflutter. Okay, you gotta know that shit, man. Diabetes, very high risk. Does it say that? Okay, good. Diabetes, extremely high risk. More than anything, really. Okay. Now, on your handout itself, do you have anything where you can see it talks about Wernicke'S or Brudzinski? Let me see what you got. Under diagnostics, a CAT scan, any of that? Okay, highlight CAT scan. I found your little thing here. Highlight the CAT scan. Okay, now, left hemisphere. Does everybody see the left hemisphere? Okay, what kind of stroke did it give you? Right-sided, and then I told you L for left, L for language. So there's your aphasia. You see the aphasia? Put your Wernicke and put Broca. What was Wernicke again? Receptive. Nursing goals, decrease the ICP. So highlight that, decrease the ICP. You don't need no ICP up in here. On the right hemisphere, it says left-sided weakness. R for right, and I want you to add two more things, reasoning and rational. So R for right-sided stroke interferes with your ability to reason and to be rational. Under causes, I want you to add hypertension, HTN. Put hypertension, number 1 cause. Put for atherosclerosis, number 2. Do you see where it says embolism? What do you know you got to write? AFib, A flutter. For thrombosis, you got to make sure you know that's ischemic. Under cerebral hemorrhage, for that one, you're going to write subarachnoid hemorrhage, SAH, and slash it with occipital headache and seizures. So I'll say that again. For cerebral hemorrhage, write subarachnoid hemorrhage, or SAH. Write your occipital headache and seizures. Remind yourself that the occipital headache or the subarachnoid hemorrhage patient is the worst headache they've ever had in their life. If they're younger than 30, put cocaine. Remember, young people, ain't no telling what the reason is. Okay, in the middle of your page at the very top, do you see where it says TIA? Yes, no, maybe. Okay, highlight right above it. Typically lasts less than an hour. It's short. Turn the page 2 times till you get a guy sitting in a bed. I'll see a guy sitting in a bed with a wheelchair on the side of him. What kind of stroke did he have?
Right side of left. Left side. Or is this right side? I can't.
You gonna need to tell shit. You gonna be a fucking nurse in 5 minutes. What the hell?
But the pupil's dilated.
Okay, nurse, shit. Look at the rest of the body. What kind of stroke did he have? You tell me your guess, baby girl. What you think, baby? How about you, sweetie?
I'm gonna say, left, right side of.
Okay, what you think, sugar? How about you, Maria?
Left side.
What you think, baby? Okay, which side is weak?
Right side.
Okay, so okay, we're gonna spank that butt. Okay, so what I'm trying to tell you is these are real people. In 15 minutes, you out here with the best of them. You're gonna look at this person and know that not only do they have a left-sided stroke, you're gonna start understanding that soon, if not already, Broca'S aphasia or receptive aphasia, language issues. L for left, L for language. That's gonna be your priority with the nurse, with the patient. As a nurse, you're gonna know, shit, she ain't gonna be able to talk tomorrow. When this is all over, I'm gonna come here tomorrow, she ain't gonna know what I'm saying. It depends on which kind of aphasia she has, but it's gonna be a language issue. Now, turn the page. Left side, do yourself a favor. Put language, right side. You got right side first, right, guys? Okay, put reasoning and rational thought. Reasoning, rational thought, judgment. Highlight judgment, it's already written for you, but you got to write reasoning and rational thought. So judgment. Look at the picture. Color his stroke in his brain, which is on his right side, and then color the left side to show that's what side is weak. Turn your page, Maria. Okay? They're going to argue. These people argue with you. They're unreasonable. They're really something. Turn the page to the left side. And on the left side, just write language. And put in your notes, these are usually right-handed people. So the majority of Americans are right-handed. The majority of Americans don't have a left CVA. You can also have Broca'S aphasia from a frontal stroke. You can have Broca'S aphasia. So put Broca'S aphasia from a frontal stroke. And you can have receptive aphasia from a temporal stroke. Here's temporal. These are temples. Frontal's this. Temples are here. Okay? Sometimes they can tell you where their head hurts. So it just depends. Okay, keep going. Turn. Temporal is receptive and Broca'S expressive. What's the other word for receptive? Wernicke'S, yeah. Okay, keep turning.